This room is completely filled up. That you are all here to listen to us about Yemen.
If we continue in English, that's great. I have a question actually for you. You said you constantly need to make that decision who to help. Where do you base that decision on? Because that is probably the hardest decision in the world.
Yeah, it is. It definitely is. So we have what we call beneficiary criteria. So basically we have a standard sort of set that we start out with, and then but when we enter a village or communities, we sit with the community elders. So basically with what we call a beneficiary selection committee, and then together, so with community representatives, with government representatives, and with our staff, we decide on this is the list, and then we go into the communities to find out, okay, who fits the list. But of course, it's very complicated. So at the moment we're prioritizing, of course, pregnant and lactating women and mothers, because they're also usually the first ones to give their food to the kids, right? So so that's one criteria. But I mean, in the very deteriorating situation where now 1.25 million public servants are not getting paid. It means there's a whole additional 9 million people who are now living below the poverty threshold, which means that they are also making requests to us as organizations. WFP, Wereldvoedselprogramma for the VN, they don't have any money to meet all the food needs of this year. So they have some, but it's not enough to cover all the food needs of this year. And they say when they were presenting their strategies, and a lot of the agencies here are also implementing partners for WFP, which means we hand out food. WFP brings the food in, we hand it out. They're saying we also have to make the decision who is dying tomorrow and who's dying today, just because there isn't enough. So and also then and that's also in particular where these beneficiary criteria are also criticized very much, and it's a really tough process. People want, the different power holders want insight, who was on the selection, who made the cut, and who didn't make the cut. So it's really tough. So the best way is for all of us to be transparent, for all the agencies together to agree on some of these common denominators, so the shared factors, just so that we are honest and open about it. Is there?
Can I have a follow-on question?
Sure.
I know that's a very difficult situation.
Yes.
How do you manage that perception then? Because at one point you make a decision. Let's say City A. City B knows you support now City A based on your criteria, but they are in the same situation. How do you manage that perception? Because they will probably say, well, you choose for them. And it's way more complicated than that, of course, but that simple perception, why do you help them and not us?
Yeah, that's another one. So one of the other things we really try to look at when we make even the selection on which area of the country are we going to, is also already on where are we also doing no further harm. So I think do no harm, like it's a very common principle, but also a very, very difficult one to uphold, especially in a country where it's very difficult to differentiate now between who needs it more. So I think, but again, it's really important to include people in the decision-making process, to have a transparent and open way. But it's really tough, and sometimes we make mistakes. And sometimes we also succumb to the pressure of different power holders if they push us, and we do. I mean, we're not without faults, but I think overall we really try very hard. But yes, I mean we need more money. I mean, we have at the beginning of the year we started with what we call the humanitarian strategy for Yemen, and it's only funded for 33%, and then there's more pledges. So governments have said this is what we're going to pay, but they haven't paid up yet, and we're desperately waiting because we're now in month 7 of this year, and there's still so much more that needs to be done. Not a perfect answer, but in back.
Yeah, I'm Fasil Wael, I'm from Yemen. I'm working with the Yemeni NGOs. Actually, I have 2 questions. Part to Lina point regarding the cholera outbreak. Yesterday, I just had a meeting with our colleague in the health program, and they informed me that the basic or the essential cholera treatment is not available at the market, like the oral rehabilitation therapy, IV drips is not any more available in the market, which is really just raise an indicator. My question, what, as a Dutch Relief Alliance, what is your role in this area? I would like, here in Netherlands, we have a lot of big pharmaceutical companies. As a Dutch Alliance, do you have any role to coordinate with these pharmaceutical companies to mobilize some resource, some medicine, and send it to Yemen? This is one question, and the other one, also the Dutch Relief Alliance, what is your role inside the Netherlands to raise the awareness among Netherlands about the humanitarian situation in Yemen, the crisis, let's say bring mobilize more resources. And thank you, and really the effort of the Dutch enterprises in Yemen are highly appreciated. Thank you.
So, okay.
Can you start?
Yeah, just to let you know, of course, the number of the oral treatment units in Yemen is not enough. That's one. The second thing is there's, for different reasons, there's a standard by which you operate these centers. The third thing is, even if you mobilize the resources and they are there and you want to bring a shipment in, the wide outbreak and spread of cholera is oh, I thought.
I'm hiding from this question.
I know, it's high, and that's why I'm like, did you choose the wrong time to go to the toilet?
I'm here.
So that would be my answer to it, and I think Yolene is better positioned.
It's just because I'm Dutch, isn't it?
I know, yeah.
No, I think the engagement of pharmaceutical companies is very, very important. I think that's also a very good question. And I think there's definitely more that we can do in terms of finding ways to engage. The private sector is struggling in Yemen, as I think you probably also heard in the same conversation as well. I think the other issue is getting the supplies in. The Hodeidah port is only functional for 40%. I think the one in Aden is also struggling with full capacity, so it's very difficult to get the supplies in, also to get the supplies in fast enough. So there's another issue as well. I hear in the market there's a lot of outdated medicine as well. So and I think at some point there's a risk in taking that too. So yeah, there's definitely issues, and I think one of the meetings we had today or this week is also looking at how can we be more creative and innovative with the private sector engagement, and I welcome any ideas, really, and I think all my Dutch colleagues here as well, so maybe finally after, and I think also our care CEO is there too, you can talk to him.
And the other question about how do we raise awareness, that's by organizing events like this, and making videos and spreading that through social media.
Yeah. 6 months ago, we saw her here in the video from Spa.
Yeah, correct.
Yeah. So
yes.
I know in Yemen the media can't come inside the international media, but in Netherlands, I think why NOS, for example, not here. Why the Dutch media is not here?
I invited them.
Yeah, but I invited also them 6 months ago. But hey, hello. Can you promise us that we see her on the television? Because we have a lot to tell the Dutch people.
On the newspaper, I think.
Yeah.
And they're safe.
Yeah.
Yes. Thank you.
I just need to clarify one point about Aden Port. It's okay, I have a big one. About Aden Port, actually 2 months ago, I guess, or a little more, they announced the readiness of the port to receive whatever. Actually, the commission, the High Relief Commission, was always discussing that with all the international organizations, that Aden Port now is ready to receive any kind of humanitarian, and as a government, we are ready also to facilitate the access of all the humanitarian or medical assistance to Yemen, especially if we speak about areas like Taiz, like the south. In terms of the distance, it's much closer and less expense to use Aden port instead of the Hudaydah one. Especially also that we have heard many news about the Houthi militia are blocking the humanitarian aid to go from some places like Hudaydah to Taiz or other cities.
Yeah.
So that was just to clarify
Yeah.
that.
Yes, great. And I think we're getting some supplies in through the Adam port, so that's great. Yeah, thank you.
I see a lot of questions. First we go there. Teddy?
Yeah, thanks Nina and Jolene for going all the trouble to come here to The Hague. Really appreciate it. At the same time, I feel that you might be in the wrong place because there's a big conference going on in Hamburg today, the G20, and actually the power holders are all there. So how are we going to make sure from this audience that we really reach out and get this on the agenda of Mr. Trump, Mr. Putin, Mrs. Merkel? I know that my colleague in Germany is trying very hard and other organizations as well, but it's very difficult to really get it to their attention. So how are we going to create this tribe to get it on their agenda? Because I think somebody has to tell the Saudis how they can help to end this conflict.
Any suggestions?
That's not just to lead answer. I think we. I feel a vibe here in the room. So how are we going to? How are we able to send a message?
I have no answer, but I wanted to follow up on that. I was, even though I'm Dutch, I was born in Yemen. I'm a child of humanitarian workers. They worked in the 19s in Sabah. And right now I'm studying in Amsterdam a program. It's called Peace, Trauma, Religion. So it's peace building and trying to get religious institutions involved in peace building. And when I